How can I avoid a lung cancer misdiagnosis? Getting the right diagnosis for lung issues can be tricky, but knowing how to navigate the process can make a big difference. Lung cancer symptoms like cough, fatigue, chest pain, or shortness of breath often mimic common illnesses such as bronchitis, pneumonia, or the flu. Because of this overlap, doctors might initially think it's a less serious condition, especially if symptoms are mild or come and go. Early-stage lung cancer might not cause noticeable symptoms at all, which makes detection even harder without proper screening. Imaging tests are crucial in diagnosing lung cancer. A chest X-ray is usually the first step, but it has limitations. Small tumors or those hidden behind bones or blood vessels can be missed. A computed tomography scan offers more detailed images and can detect smaller or hidden tumors more effectively. However, even CT scans can sometimes overlook tumors if the images are not carefully reviewed or if the tumor is in a difficult location. Observer error can also happen when radiologists miss subtle abnormalities, especially if they are tired or handling a high workload. Technical issues like poor image quality or patient movement during scans can also contribute to missed diagnoses. To reduce your risk of misdiagnosis, be proactive about your health. If you experience persistent coughs, unexplained weight loss, chest pain, or shortness of breath, don't ignore these signs. Seek medical attention promptly, even if your symptoms seem mild or resemble a common illness. When talking to your doctor, share your full medical history, including smoking habits, exposure to secondhand smoke, occupational hazards like asbestos, and any family history of lung cancer. This information helps your doctor assess your risk and decide which tests are appropriate. If you are at high risk, such as being a current or former smoker aged 50 to 80, ask your doctor about low-dose computed tomography screening. This type of screening is recommended by major health authorities for early detection in high-risk groups. If your initial tests are inconclusive or your symptoms persist despite treatment, don't hesitate to ask for further testing. Additional imaging like a more detailed CT scan or referral to a specialist, such as a pulmonologist or thoracic oncologist, can be very helpful. Getting a second opinion is also a wise step if you have doubts about your diagnosis or if your symptoms are not improving. It's important to communicate clearly with your healthcare provider. Make sure you understand your test results and what they mean. If anything isn't clear, ask your doctor to explain it in plain language. Don't hesitate to voice your concerns or request additional evaluation if you feel your symptoms are not being fully addressed. During your initial consultation, your doctor will ask about your symptoms, medical history, and risk factors. They may order a chest X-ray or blood tests. If anything abnormal appears or if your risk factors are high, further tests like a CT scan, biopsy, or referral to a specialist may be recommended. Be honest and detailed when describing your symptoms and history. If you feel your concerns are not being taken seriously, or if you're not offered appropriate testing, speak up. You have the right to ask questions and request further evaluation. Involving specialists early can improve diagnostic accuracy. Pulmonologists, thoracic surgeons, and oncologists have specialized training in lung diseases. They can perform advanced imaging or procedures like bronchoscopy or biopsy to get more definitive answers when initial tests are inconclusive. If you suspect a misdiagnosis, act quickly. Request a referral to a specialist, seek a second opinion, and insist on further testing if your symptoms continue. Early and accurate diagnosis is key to effective treatment and better outcomes. Remember, avoiding a lung cancer misdiagnosis involves being aware of your risks, understanding the limitations of initial tests, and advocating for yourself during medical visits. Provide a complete history, ask about screening options, request additional testing if needed, and consider a second opinion. Staying engaged and informed can make a real difference in your lung health journey. Always follow up with your healthcare provider and communicate openly about your symptoms and concerns. Your proactive approach can help catch lung issues early and improve your chances of successful treatment.